So, hello everyone, and a very, very warm, happy monsoon to one and all. And welcome to yet another empowering edition of The Vibe Live. The Vibe that stands for Women Inspire, Build, and Enhance is a platform dedicated to fostering women's excellence. It brings together women doctors from diverse specialties to share knowledge, leadership experiences, and personal journeys that inspire both growth and collaboration. There are four fundamental pillars of the vibe: physical well being, mental health, financial wisdom, and professional excellence. Through various initiatives, the Vibe strives to build a strong community of women professionals who uplift one another and redefine the landscape of healthcare leadership. I'm Dr. Ritu Johri, consultant diabetologist and metabolic expert practicing in the western suburbs of Mumbai. I have a unique diverse background with decade and a half spent in pharma industry and now last half a decade practicing diabetes, thyroid, and obesity. Besides clinical practice, I also contribute to medical writing as a co-founder of Arfect, a medical marketing agency. But what brings me utmost pleasure in sharing is introduction of this exclusive initiative, The Vibe, along with these four dynamic women as a founder of one of its kind platform. I'm blessed to be complimented by my husband, who's an orthopedic surgeon, and our family feels complete with a teen son and a toddler daughter. With that, first of all, welcome on board the dynamic speaker today, Dr. Kirti Samudra. Ma'am. Hello, ma'am.
Hello.
Good afternoon.
Good
And now,
afternoon. Happy to be here. Yeah.
so nice of you. And now we proceed to Dr. Lotika for her introduction.
Yeah. Good afternoon, everybody, and good afternoon and welcome to Dr. Kirti Samudra for our Wildlife Hexalog today. I am Dr. Lotika Purohit, a diabetologist and lifestyle medicine physician practicing in Colaba, Mumbai for the last 3 decades or so. I am also a visiting faculty at the JJ Group of Hospitals, and I'm part of the executive committee of the National RSSDI, which is a research society for study of diabetology in India. Besides this, I am very happy every Wednesday afternoon when we have this initiative wherein we get a star speaker, a woman physician who's an achiever in her own field, and to share experiences, have meaningful conversations, and discuss what are the challenges that she has faced and overcome. Now I hand over to Dr. Pranjali Shah for her introduction.
Good afternoon, ma'am. I'm Dr. Pranjali Shah, Director and Chief Diabetologist at Diabetes Clinic. It's in Mulund. And I also handle internal operations in iHeal, which is led by my husband. He's a cornea transplant surgeon. So we have Eye and Diabetes Specialty Center, and I believe community awareness plays a very important role towards prevention of all these metabolic health problems. So we do a lot of awareness camps towards awareness and prevention. But apart from this, if you don't find me in my clinic on weekends, I love to do hiking, help animals in their animal shelters. I do farming with my boys, and definitely Wednesday vibe is something which we look forward to connect with like leaders like you on every Wednesday, ma'am. Thank you so much for being part of this lovely Hexalog today. Over to you, Dr. Rukia.
Hello, ma'am. Good evening, rather. Greetings from Vancouver today. So happy here to be with all my girls. And Dr. Madam, I'm so glad that you accepted our invitation being here. So I'm Dr. Rukia Surya Sheikh. I'm a diabetes, thyroid, and an obesity specialist practicing in Mulund for a last decade and a half. And, this journey has taught me that healthcare is not just about treating numbers, it's more about understanding people. I am supported by my husband, who's a medical oncologist, and two wonderful children. One who just completed the grade 10th and another one in grade 7. And while I'm not in clinic, I love to have my workouts. I love to play carom, love traveling. And what brings me joy is this great company and the meaningful conversations that we have, especially on the Vibe Wednesdays, which make you think, you make me laugh. And also, I have recently started painting, which is the way of adding little color and calm to the chaos of our daily lives. I'm truly excited to be here today at 2:30 a.m.
Great.
With all of you to learn, to share, and to grow together. Over to you, Dr. Kavita, for your introduction.
Thanks, Dr. Okay, and good morning to you. Good afternoon, ma'am. Welcome to the Vibe. I'm Dr. Kavita Rane. Namaskar, everyone. I practice at Chambers for the past 15 years in the field of diabetes and obesity, and the director of operations at Rane Hospital. I'm also the founder of Diabetes Total, which is my own clinic at Rane Hospital and Apollo Spectra. Apart from diabetes and obesity, I love to draw and paint. I love EDM music. I love to travel. I love this Wednesday group of ours and these gorgeous ladies here. And I learn so much from every single superstar like you who comes and discusses with us every Wednesday. So over to Dr. Rukia. Sorry, over to Dr. Ritu.
We all love
Morning.
Rukia so much. Rukia तो इतना दूर कहाँ चली गई Vancouver में?
Sorry,
So yes, everyone, it's truly a privilege to be connected, and I definitely want to speak out that this is what our camaraderie means. That whether we are in India or outside of India, we ensure that we still get back, circle back on every Wednesday to have our star speaker and to have a conversation with them, and of course bring those clinical pearls for you as well. So, with that, today is very special. First of all, again, a very warm welcome to you, Kirti Samudra, ma'am. We have been really wanting to have you on this episode, and it's a dream come true to have you. So, just a quick question: how did you feel when you were first invited for the Vibe Live by Kavita?
Yeah, actually, I was excited, and today, after meeting you here, I'm still further more excited. I'm feeling, but that I have become very senior now. Looking at your zeal and enthusiastic nature and what you are formed this platform, it's really wonderful. We couldn't do it when we were young like you, but. It's a great thing. I'm very happy for being here.
Thank you so much, ma'am. Ma'am, it's truly great to be connected with you, and I'm loving that fact that you liking it. So we will want you to be with us, connected, even apart from this particular
Sure,
call today.
sure,
So,
sure.
with your permission, I would like to just say a few words about you. So basically, it is indeed a privilege when we talk to somebody who's dedicated over 3 decades of their life, their career to transforming diabetes care and touching countless lives through various commitments, whether it is patient care, whether it is treatment, whether it is education for them, or whether it is even the excellence that you bring in through your various initiatives. Dr. Kirti is, of course, an accomplished diabetologist with an MD in general medicine, a scope certified obesity consultant, and also a fellow in mind, body, and medicine. A true pioneer in the real sense. She's established the first dedicated diabetes clinic in Raigad, which is absolutely commendable, and has spent last 30 years not only treating patients but also empowering them with knowledge, as I mentioned, and confidence, giving them confidence of taking care of their own selves, as we understand that self-care in diabetes is optimally required. And then she's also a very sought after speaker. As you can see, we've been also wanting to have her here at various regional and national conferences. She's really looked upon. She's been consistently championing the importance of holistic care as she passionately follows mind, body, and medicine. She's been blending medical science with the understanding and lasting health extends beyond prescriptions and numbers. So, as a woman achiever, the journey is definitely a reminder to one and all of us that leadership is not just about having a position somewhere, but it's about absolutely impacting lives and creating that difference in the society, which Dr. Kirti has done. So, kudos to you, ma'am. And based on that particular aspect, what we've done is we've tried to bring up this particular topic, which is healing with heart, why empathy is a woman leader's superpower. And I would just say that whenever we see you, it is like you're so calm, very well composed, but at the same time, you have a storm of work that speaks volumes about you. So thank you so much for being a part of this. And without further ado, may I ask Kavita to take up the first segment of the session today?
Thank you,
Thank you,
Dr.
Ritu.
Ritu.
Thank you for kind words here.
Thanks, Dr. Ritu. So, ma'am, good afternoon and welcome. So, our first segment is the journey, the woman behind the vision. Behind every successful healer lies a story of courage, vision, and perseverance. As a pioneer in diabetes care and the founder of the first diabetes clinic in Raigad district, Dr. Kirti Samudra's journey is one of passion, purpose, and impact. Let's begin by exploring the path that brought her here today. So, ma'am, what inspired you to choose medicine and eventually dedicate yourself to diabetes care?
Yeah, if I start my journey from choosing medicine as maybe while taking admission to medical college, it was just nothing like because I was a meritorious student. So that time it was when you score good marks, either you go to medicine or
This is
engineering, something. So
engineering.
wherever, because I had never seen anybody becoming a doctor. My
Mm,
family, nobody was doctor. So just like that, I went and took admission to Government Medical
mm,
College, Nagpur, and then my journey started. I did my
mm,
MD medicine, and then
mm,
post MD, I came to Mumbai. Basically, my father took up a job here in near Mumbai, so I also came to Mumbai. So post MD, I was looking for something where what to do, either whether to go for super specialty or whether to. But then I was fed up. I thought enough of studies now, so I never wanted to go for super specialty. And I met some of my fellow colleagues from Nagpur who had joined Hinduja Hospital and all. So then I went there and I joined Hinduja as a resident doctor over there. There I worked in MICU and ICU and all. And then from there I just changed to Raheja Hospital, which is a All India
All
Institute
in
of
Institute
Diabetes.
of
Yeah.
Diabetes.
So
Mm,
there actually my journey started for diabetes because
mm,
that time, first
mm,
time I um learned diabetes, I can say, because till MD also, if I go back and see, I didn't have any knowledge of diabetes even when I had passed my MD medicine. But
mm.
when it came into practice, it was so different. What we
Very
learn
good.
in the books
Mm,
and when we see the
totally
patients and when
agree.
we see, it was totally different. And in Raheja, there were 40 plus consultants. And
Yeah.
I was a resident physician over there. I had four RMOs with me, under me working. So I was getting in touch with every consultant over there, including Dr. Jgaonkar
Mm,
and Dr. PG Talwalkar and Dr.
mm,
Bhoraskar, and everybody was there in Raheja, even Dr. Arun Bal. And I started seeing the patients and learning from them actually. Everybody I thought is different. Everybody's thinking was different. So what to do? It was so difficult, but I stayed there for 1 year and I learned a lot about
mm.
diabetes in Rahej Hospital.
Yeah,
So
yeah,
journey
yeah.
for diabetes started from there.
Yeah, very true. Like what you said, ma'am, all those great physicians and doctors, and learning from them and their experiences matters. And I'm sure that you got such a huge knowledge and learning from them itself. So that's amazing. So starting the first diabetes clinic in Raigad district was visionary. What challenges and opportunities did you encounter?
Yeah, it's really interesting to, you will be surprised to know so means many things about diabetes was that time, means I'm talking about 30 years ago. Now, precisely, I can say 33 years ago. When I moved to Panvel in 1993. From Raheja, I left and in between I got married and we were just searching where to settle down, like because that period was very bad in 1992. You must be remembering that was Babri Masjid and
Right.
all this riots and all,
Mm.
everything had happened.
Mm.
So we were, myself and my husband, we were thinking that we will start something new. And we
Mm.
literally came with zero in Panvel, just like that. We thought it's nearby Mumbai and we will explore something here. We didn't have, both of us didn't have any job. We just rented one house and
Mm.
came here. Then I had read the board of Tena Hospital and
Hospitals.
Tena Medical
Mm.
College, something like that. So I went there
Mm.
and they said, okay, you can join here as a lecturer. We had a hospital here and the college was at Koparkhane that time, Tena
Mm.
Medical
Mm.
College.
Mm.
So I joined immediately as a lecturer because I was attached to hospital. So they provided me immediately telephone and everything. That time MTNL was also at Belapur, not in Panvel. So we got the phone and my job started. So at least something was there.
Yeah.
And
Mm.
then in Tena Hospital, first time I started first diabetic clinic. That too, that was in the hospital because I had come from Raheja. I had that
Mm.
thing in mind. So I that diabetic clinic in Tena Hospital was inaugurated by Dr. Yadnik. Uh,
Oh, wow.
so we had called Dr. Yadnik that time, and then when my family started, I gave birth to my daughter. Then it was very problematic for me to go
Mm.
for the night calls and
Mm.
continue with
Mm.
the hospital and college thing. So then I
Mm.
converted myself as a part-time lecturer. And then once my daughter was 1 year old, then I thought, let us start something on my own. So I started my first diabetic clinic. That time in Panvel, there was no awareness of diabetes, even in doctors. Means I'm
Mm.
not saying patient awareness, so it was very poor.
Mm.
Nobody used
Mm.
to think,
Mm.
know about anything about
Mm.
diabetes. But even doctors, anybody used to treat diabetes, even surgeons, gynacs, general practitioners, and everybody used to treat diabetes. I had seen prescriptions like plain insulin 40 units once a day. That type of prescriptions were used to be there. A
Oh my
patient used to
gosh.
go to a surgeon for surgery. That time he was to put on 3 times insulin, and the patient used to continue that insulin years together, short acting insulin 3 times a day.
Mm. Mm.
And
Mm.
nothing, no HbA1c test, nothing. Even when I started, I was also not doing so much of test and all because we used to feel that it is very costly test and
Mm.
lipid
Mm.
profile and this thing. So it
Mm.
was very
Mm.
different type of scenario at that time. But even people were laughing at me, all the physicians and other people, they were thinking, what is this diabetes care clinic? Nothing means how many patients you're going to get. So I said, at that time I said, no, I want to practice limited hours and I can't see so many patients, so that's why I'm doing this. So that's
Mm.
how it started.
Right. So how so looking back at 3 decades of practice, like how what has been your biggest source of satisfaction?
um Actually, I I can say my patients only, whom I could prevent the complications in
Mm.
them, whom
Mm.
I
Mm.
could educate them very well. I
Mhm.
could control their
Mm.
diabetes very well. And when I am seeing even people who are coming from 30 years to me and still they are devoid of any complication, they have not yet
Complications.
developed any
Yeah.
nephropathy or anything. That's I feel that
True
it's that is the
satisfaction.
achievement which
Mm.
I feel that it's
Totally, totally. True satisfaction, ma'am. So
yeah.
thank you very much. Over to Dr. Ritu for segment two.
Thank you so much. Am I audible?
Yes, yes.
Okay, great. So, ma'am, first of all, I want to say that, it is such a pleasure because I'm from Koparkhane and,
Oh,
and I still and I still remember a couple of times when I used to meet you earlier. So it's such a journey and you've not changed. It's as if you're defying age, you're defying the clock. Nothing has changed. You're still the same that you were. So that's a great compliment and love your
thank
passion.
you.
So
Thank
My segment, ma'am, now talks about evolution of diabetes care. And as you clearly just mentioned, that diabetes care has witnessed a remarkable transformation from where we started, where versus now we are 3 decades later. From whether it was the strips that we used to use for urine testing, and now we have such advanced machinery and also technologies to help the management of diabetes. So when it comes to diabetes management for you, like you said, when you begin practicing to today, how do you feel, and how do you navigate that way of looking at diabetes?
Yeah, it's a great question because I also feel that technology has changed a lot. Uh,
Hmm,
Even the knowledge, information, what we are getting so quickly now, and availability of
correct.
the medicines. So when I started practice, literally there was nothing but sulfonylurea, metformin, and insulin, that
True,
too
ma'am.
very basic insulins we used to. So whatever we
True.
will learn or will talk or we read, but still what to offer to patients, nothing. We just have very few drugs. So we were very excited when first time rosiglitazone and pioglitazone. So it is something
Yes.
has come for insulin sensitizer, to reduce the insulin resistance. Very much excited, and we got very good results. It means I will say that later on rosiglitazone got banned, but I have used
Hmm.
rosiglitazone a lot and got very good results. So even a carbos, when it came, whatever new drug came, we used to get excited. Okay, something is there now which I can offer to my patient. Initially, as I
Correct.
said, we were also not doing so much of screening for complications and all.
Right.
We used to get means a little bit skeptical that, oh, then patients will not come to us because, and this has happened when I wrote insulin prescription, patient disappeared. Sometimes it happened,
Yeah.
but after 1 year a patient used to come with the same prescription that last year you had advised me insulin, but that time I didn't take, but now I am ready. So this type, and for that matter, actually I started this patient education a lot. Means I am doing a big program like a conference for patients since last 28 years, and that started because of that only, that patients need to be taught about what is diabetes and why they should be taking care of diabetes, and they should not neglect their things. So but technology really has made wonders, and now with all the CGM and everything available, like, and even the patients who have become lot aware, and so many drugs now we have, lot many drugs which we can offer, and what we used to talk about individualization of the therapy, that we can do it now. Earlier it was whatever we say, but we there was nothing available for whom we should be giving what medicine, that nowadays we can decide that. That's very.
Totally agree with you, ma'am. In fact, I just think that, when I look at the octet and I see that, okay, today we are talking that incretins are there, SGLT2s are there. We have tools to manage those, pathophysiological deficits, which was earlier not possible. I mean, like you said clearly that, yes, there was only sulfonylureas and metformin at the max insulin, which is physiologically simulating.
Yes, yes.
But today, yes, of course, that is the, beauty of having so much of tool and ammunition to our armamentarium with diabetes management. Wonderful. What are the biggest misconceptions, ma'am? Since you're already working on so much on patients, I'm sure you also come across, like we do, that patients still have their myths within their minds. So, what do you think that about diabetes or about obesity? What are the misconceptions that these patients have?
Yeah, patients' biggest worry is lifelong treatment, means they have to take
Hmm,
medicines lifelong. So they feel that
correct.
because I will take medicines lifelong, they are going to harm me. Even the what kidney,
Hmm,
they have that thing in mind that if I take allopathy medicines so many years, my kidney is going to get fired. Then they don't understand that this is diabetes is going to affect the kidney and not the medicines. So that we have to categorically tell them that no, the medicines are such that they are going to save your kidney. So that is a very big
correct,
problem.
correct.
Regarding insulin also, they feel it is the last resort. It is miss abhi sab kuch ho gaya, now this is nothing
Correct.
can be, so it is the last thing, or they take it as a punishment. Sometimes our physicians also say, we also threaten the patient, like if next time tak nahi hua to you will be given insulin. So that we sometimes use it as a threat. That is also that's why that thing is there in mind. And basically diabetes also now they know that it is, but when I started practice, that time people never used to know that diabetes is a lifelong problem. They many people used to come to me and they said कि हाँ 10 साल पहले diabetes था फिर ठीक हो गया था, something like that. So they were not
Ah,
even knowing that ये
yes.
ठीक हो गया था जो है. Now we are talking about reversal and all, but we know it is the remission, it is not the reversal as such. So that also we have to tell them
True.
that yes, you are without medicines, you are controlled, but that doesn't mean that your diabetes has been cured. So
Correct.
that
Cured
myth
or
is also
something.
there.
Correct.
Yeah, they feel that it can be cured when we talk about reversal. So that is also a big myth they feel.
Wonderful. I think, yeah, that these are really those things that, all of us face. And, I think you're doing really a great thing by educating them, because not a lot of people are able to do that. And, when we meet patients, probably, we don't reach so many. We reach only, a segmented number of those. So kudos to you for your initiative. Coming to the last question of the segment, how do you balance scientific advances with the art of patient communication? And basically, ma'am, just to give you a little background on this question, this is from the fact that, when you look at today, we are having Googles of the world, we are having chat GPTs of the world. So we know that when the patient is coming to us, they're already coming with some set premonitions, they have some answers with them, and they're now coming here only to cross check probably of, how we are doing and what the doctor is going to tell us. So how do you see that balance coming up in your communication?
Yeah. Fortunately, I don't get all such type of patients because I get patients from all the small villages also. So I have some all different state of patients. Only few technologically advanced people will come to me. Those will have that knowledge of chat GPT and all. Others sometimes they're not even sometimes they're illiterate ladies also. We have to even show them that do you see this number, do you use your phone,
Right.
you can so
Right.
that type of patients are also there. So very
Hmm.
different, I have to use different language with different patients. So
Right.
the person so if person is educated, then my way of communication is very different. The person who is
I-
just illiterate, I start in a very different way. So if looking at the patient, I change my way of talking, my how do I educate that patient, something like that. It is very different for every patient in my practice
Visualize.
every day.
Ah, that's wonderful. So I think, yeah, individualizing treatment communication also is part of that treatment. And so, of course, yes, you have to get down to the level of the patient ki kya unko samajh mein aa raha hai, what is it that they are going to understand, what is their, who's going to be the caretaker, and what kind of understanding or educational level also they may be having. Sometimes perceptions can be also different, and therefore, that's amazing. I think brilliant answer. Thank you so much, ma'am. I think I really loved every single answer that you just gave in. With that,
Thank
let me pass on the baton to Dr. Pranjali for the next segment.
Thank you so much, Dr. Ritu. Ma'am, it was really nice listening to you. And my next segment is about beyond medicine, mind, body, and obesity. So, ma'am, we talk about it's metabolic diseases is not only about the numbers. It is about a lot of stressors, your obesity, your sleep disturbances, emotional well-being. Everything matters when we are treating any metabolic diseases. So, ma'am, this we are discussing right now, but I've seen that you have pursued your fellowship in mind body medicine maybe many years ago. And then what made you think to go beyond this conventional medicine and start with this holistic approach when you're dealing with obesity or diabetes or metabolic issues?
Yeah, actually, patients themselves means who we meet so many people every day as patients, and every patient is different. And we find many of the patients have all these stressors. They have what is at the background is true, and they are also very open to us. Means you must have also realized that, and you every one of you must be experiencing that they immediately open up with you and they tell their problems with you. Even if we are meeting them for the first time, they don't hesitate to tell you. So that happens, and that is where we understand that the problem is very different. though they're coming to you with physical problem, but the problem lies deep inside somewhere. I will give you one information that I work for one social organization also, and in
Okay.
that organization, I started one clinic called Astha Ek Aadhar Sambh. So that is a free clinic, and I have educated in our organization only some of the members who were so much interested. I took some sessions with some psychologists and psychiatrists, um, and taught them how to be a good listener. Okay, so because nowadays we know that people want to speak, but there is nobody to listen to them. Even in the families, nobody has time, and families become nuclear. So even miss there is age doesn't matter. Even the elderly people and young children, everybody, nobody is there to listen to them. So we have given them a platform where we call all these people as Manas Mitra, and we have given one number, and they will just contact that number, and we will provide that Manas Mitra for 1 hour to that
Okay.
particular person who wants to speak out. So that is different. It's not for patients, it is for anybody. But then I realized that I am doing the same job in my clinic, be, listening to
Listening to
them.
the patient. Yes.
So we have to. So I said that I am doing this Asta clinic since many years, and now with this realization that yes, it is required. So if we give some 5 minutes also to our patient and listen to them without our anything interrupting them, that
Yeah.
works very well.
Yes, yes, ma'am. So, ma'am, so like when you're seeing your patients, as you said, you have mixed crowd, or patients might be coming from villages or some patients from the cities. So, when we are doing counseling or when we are teaching them about the lifestyle modification, like stress reduction or sleep or emotional well-being, so how do you counsel them? What practical advices you give to your patients? Like, suppose we advise our city patients, then they will understand. Sometimes when the patients are coming from villages, you tell them to do meditation. Maybe I don't know, but how do you tell them to go ahead in your practice?
Yeah, it's very difficult. We can't tell them to do meditation, and especially the ladies who are. So I just tell them that what do you like? Do you do something for God, or do you read something, or like they do some job वगैरह, something like that. I just ask them that some are means what do you like, or what you have missed in your life. That way I start sometimes that
Okay.
what will you like to do now at this
Hmm.
stage of life. So many then they also start thinking. They had never thought like that. Some of the ladies I have especially seen that they have not thought on those lines. When I ask the question, then they will start thinking on that line, that what really they miss or what they really want to do, and then they will come out with the answers. And from them only we have to take out that what exactly will relax them, what will be good for them, and then we can counsel them like that.
Yeah, I think the detailed history tracking and observation, I think that gives you a lot of hints from your patient how you're going to go ahead.
Yes, yes,
And
yes.
my last question to you, ma'am, many patients struggle with obesity and emotional eating and lifestyle modifications. So we can't say it is lack of, willpower. So when, as a healthcare, if you want to suggest a tip to other professionals, how should we deal with our patients in our clinic?
We should not look at them as a their fault. It should not be a we should not stigmatize them. Means getting diabetes or getting obesity is not always their fault. It is okay. Wrong lifestyle, eating outside food, and all this. Okay, that is there. That is wrong. But that doesn't mean that we should always blame them. We have to show them that at least we are there to help them. Whatever is the problem, why this is happening, that we have to do. We can initially we can just tell them few small things to change. We can't expect sudden change in the lifestyle. So
Yes.
sometimes I advise sometimes them mindful eating. Like if you can't control, if you're foodie, if you like eating, okay, don't means I will not make him deprived of all the joy in the eating, because that is something which they get pleasure and joy. That should be there. It should not,
Yes.
that they should not go into depression that now everything is stop and all. So whatever I tell them that okay, if you want to eat gulab jamun, okay, have only one, and not every time. And that too, what you do is you put it in your in front of your eyes, look at it first, get pleasure from your eyes, then smell it, then touch it, then take a very small bite, put it on the lips, then do it and chew it for a longer time. You will feel satisfied even with half gulab jamun.
Yes.
So that is, I am advising them basically mindful eating. So
Yes, ma'am. So, ma'am, actually, I should say my segment, you know, when I'm looking at the title, mind, body, and obesity. So, when I'm seeing, I'm sure when you're treating your patients, you're so calm. So, you actually justify, you know, as a holistic physician and, you know, thing because your body language, you're so calm and the way you're treating your physicians, I'm sure patients might be very happy when they're coming to you. So, thank you so much for your inputs, ma'am. And
thank you.
over to you, Dr. Lotika, for the next segment.
Thank you, Dr. Pranjali. And really, it's very nice listening to you, Dr. Kirti, because so many interesting things that I'm learning along the way while talking. So, my segment, which is deals with wisdom from experience. So, experience, we all know, is one of our greatest teachers. And as somebody who's been dedicated over the last 3 years in treating people with diabetes, obesity, and other metabolic diseases, we love to hear the lessons from that. We all know that 30 years ago, what the diabetes and obesity has changed so the one of the if you could share a lesson that you
I think Latika's voice is cracking.
from one of your patients as to what would be an interesting what would be an interesting experience what patient taught you in the management of diabetes. So, hello.
Uh, I think I missed few words from Latika's question, but I guess that she was
So,
asking about how maybe some patient, yeah, means if some patients think
What are
have.
the lessons learned from patients is what is her question. Any lessons that you feel patients have taught you?
well,
Prashna.
in the
Yeah, I
last
can, yeah, I get it now. So
in the last
basically,
30 years that
yeah, last 30 years, definitely patients have taught me a lot. Our patients only teach us a lot. That I have understood. Seeing different types of patients. Maybe earlier, now I feel that if I would have done such thing for my patient, maybe whether I could have prevented something. Now I feel that if I would have got these kind of drugs like GLP-1 receptor agonist and SGLT2 inhibitors about 10 years ago, maybe a picture would have been different. Those patients who are whom I am seeing suffering with the complications, whether I could have prevented the complications in them. Sometimes even I tried actually my level best every time to tell them or examine their feet also. Like I know I told you that Dr. Bal, I learned many things from Dr. Bal in Raheja Hospital. When I started my clinic in Panvel as a diabetes care clinic, Dr. Ajgaonkar and Dr. Bal had visited my clinic, and they told me that just put a small mirror at the backside of the when examination table. So when I used to check the BP of my patient, I could see his feet in the mirror. So if anything is there, any callus is there, any corn is there, or something like that, and then I go and touch his feet. So that has come so means it is so now practice for me that I start from the head and I go to the feet of the patient, touch the feet and see the soles also and everything. So that completes my examination in just few minutes. So that was a lesson from Dr. Ajgaonkar and Dr. Bal, that in the beginning at the start of my practice only. So that is continuing. But still, sometimes patients they, even if after telling all the care, foot care and all, still people used to come with so much of problem with the feet, and still they come with and they land up
Yes.
into amputation.
Yeah.
So there we feel that okay, somewhere whether I have missed or whether I was not that aggressive in teaching patient that this should not have been done. So that is the thing
Yeah.
which I feel.
Yes, and food care is so important, in people with diabetes. And but this is so nice, interesting that you shared your experience of how putting a mirror so that you could easily see the sole of the foot, and thereafter, of course, touch and see whether the pulsations and examine the foot also. So, of course, diabetes, as we know it, has changed a lot in so many years. In today's time, what would you advise a new young doctor who's coming into the field of diabetology today? What would be your pearls of wisdom for her or him?
Uh, I will definitely insist upon talking to patients and listen to them. Just give few minutes of yours to listen to them, and just don't only see the reports and change the prescription. Even if you don't have to do so many means complete examination, but at least touch them somewhere, check the pulse or do something, so they feel comfortable that yes, doctor has seen me. Only report is not the answer, because nowadays most of the times they will send you the reports, they can even mail you and you ask for the change of prescription. That is sometimes okay if patient is not available or patient is busy and you, it's your usual patient, you can do that. But after 6 months at least you tell them that no, you must come and visit, at least see the patient personally, physically, and definitely talk to the patient and listen to him. That's the thing.
That is so true. Just talking and communicating with them is so makes so much of a difference. Tell me what excites you. Suppose you have a looking glass. What would be the thing that would excite you about the field of diabetes in the future?
The excitement is the newer drugs only. I feel that something it's coming like the treatment is becoming quite simple.
Mhm.
Like now it's once a week GLP injection. Now it will come once a week insulin injection, and then maybe a combination of insulin plus GLP plus SGLT2. It will solve the problem of means most of the ominous octet what we are talking about, the pathophysiology of diabetes. We are hitting almost to that part of the type 2 diabetes pathophysiology, and maybe it will become simpler. No fear of hypoglycemia much, no weight gain, and prevention of complication, cardio, renal, metabolic, liver, all the things, CKML, what we are talking about. So I am excited about the means now actually sometimes I completed my 60 last year and I started thinking about my retirement to complete my other things in the life which I feel that I should be doing. But then I feel, oh, now so much of new things are coming, so I should be there for at least few years to give it to my patients. That so I'm excited about the therapy which is coming now for diabetes and how we can prevent the complications and hit the pathophysiological aspect.
Yes. Mm. Yeah. So actually, like how we have seen that, and whatever basal bolus, I don't think there's bolus. There was just plain and lente, I think, when we started practice, and now advances. It is so exciting, and with so many new molecules in the pipeline and things like that. So it's been
Definitely.
nice talking to you. Now I hand over to Dr. Rukaiya for the next segment.
Hello, ma'am. So,
Hello.
yeah, it's just so wonderful to look at your journey from Dr. Asgaonkar, to now you're becoming a pioneer yourself in the field of diabetology, starting with just metformin, sulfonylureas, and I'm sure that excitement that of using these wonder drugs. It's truly, I think in every diabetologist dream that you've come a long long way from what you started with. So there's so much now available to help the patients. So on that term, the audience is getting smarter and they want to know. So my segment is about the audience ask. So we have CGMs, we have smartwatches now, we have health apps, which are becoming a part of our daily life, just like we have mobiles. So are we actually becoming healthier, or we are just getting more and more informed about the choices that we have today?
Yeah, you are right. Sometimes it is information overload, and because of that, also confusion, too much of confusion in their minds also. So, for that also, sometimes we have to talk to them and we have to educate them that, okay, you follow one thing. It's not that because every other day you will get one new thing for diet also. Diet
Correct.
and lifestyle is so difficult. So, at least follow one thing. Whatever I tell them, that whatever change you make in your lifestyle is going to help, but good
True.
change. Yeah, anything you change, maybe you change your diet. If you like, okay, if you like two times, that is your choice, then I will adjust your medicines accordingly. If you want to
Correct.
eat four times, I will adjust your medicines accordingly. It's basically, as when we talk about tailor made therapy or individualization of the therapy, then that it means earlier we never had a choice. So we used to tell them about the hypoglycemia and you must eat at this hour to avoid hypoglycemia. Now we don't have to do like that. It is, we
Right.
can choose the medicines according to that person's choice and person's lifestyle. Because if somebody is traveling a lot, or somebody is having a very busy lifestyle, and so that time we can adjust, we can tell them, we can use this fixed dose combination once a day tablet, and the person will be very happy that nothing
True.
whole day there is no hassle of taking medicine or remembering thing. So we have
Absolutely.
now lots of things available and we can give them a choice.
So I'm looking back on this decades of caring for your patients. One simple truth about health that you wish everyone understood much earlier in life. If you had to give that pearl of wisdom of your 3 decades, you would be like, भैया आप आज से ये करना शुरू कर दो. It will be much sorted.
I feel, means, with so many years of my experience, I feel that you must learn to be happy. I feel,
Wonderful. Yes,
yeah,
ma'am. Absolutely.
yeah. I feel that that is the most thing which one should remember, that you have to live your life happily. For that, you can compromise on something. You can do, means, even sometimes I allow them. Okay, you if you're happy in eating like this, okay, don't feel guilty about it. At least, means, some
True.
people do that, but then they feel
Mm.
so much guilty about it that that happiness is totally gone, and then they just keep on saying that, oh, something I did and that's why this happened. And also, okay, if you're eating mango, a little bit of mango in this season, it's okay. If everything is fine, if your sugars are well controlled, you enjoy that and be happy. And don't curse yourself, or don't blame anybody
Yes.
like for that. So that is also, it should not be. See, disciplined life is definitely, it should be there, but sometimes if that disciplined life is making you burdened, or if you are not happy in the life, then what's the quality of life actually matters.
Right.
Even rather than longevity, I say quality is much, much, which is very important.
So beautiful, ma'am. So, ma'am, this thing about that's for the patients. But now, in the era of technology and AI, what should never change between a doctor patient relationship?
That physical touch,
Okay. Wow.
that
Wonderful.
that is very important. That touch is
Mm,
very important. Assurance. Um,
okay.
Even if we talk like this, okay, sometimes it's okay. But when you come in person and you just shake hand or you just pat on the back of the patient, that is, I think that will matter a lot.
Yes. So beautiful, ma'am. Ma'am, it was wonderful, just to know that how simple things in life, can just bring out joy and give the most impact than what sometimes these wonder drugs do not give. So beautiful, ma'am, about on this. Lovely. So, ma'am, coming to my last segment, which is the rapid fire segment. And I want quick, short answers to long questions that I ask you. So, ma'am, my first question to you is tea or coffee for Dr.
Tea,
Kirti Samudram? Tea, okay. Ma'am, you're an early morning person or a night owl?
early morning.
Early morning, okay. One book that influenced you deeply.
Mm, that is Marathi book, माझा साक्षात्कारी हृदय रोग. That is written by Dr. Abhay Bang. That,
Okay, acha.
so
Ma'am,
he
can you tell us more about that book?
it's basically his own experience when he had cardiac issue and
Okay.
doing while primary angioplasty also there was so many complications and he if you know Dr. Abhay Bang and Rani Bang, they are working in Gadchiroli.
Okay.
They are the pediatricians and social they are preventive type of and they have very different in the Adivasi area, they started their hospital
Huh.
where Adivasis never used to go to the hospital. So they created the hospital like huts. They created like their hospital and they they created so many Arogya Doot, like means illiterate people, they uh, trained them to count the respiratory rate and also all the mortality, maybe childhood mortality, everything they
Mm.
could reduce over there. So they have done a very great job over there, and they are doing other kind of other activities like Nirman and all for youth. So
Okay.
he himself wrote a book for on his own experience of heart attack and then how he changed everything and he has mentioned all the useful tips also in that so that I
Okay.
like very much.
I think, yeah, the audience is also going to be happy listening to this. And I think it's now one more recommendation for us to read it.
Yeah.
Thank you, ma'am. Your favorite comfort food.
Mm, really, I don't know. I have never thought about it maybe. um,
मैम वो होता है ना आज क्या बनेगा खाना तो जो सबसे सिंपल वाला है या ट्रिप के बाद आने
Simple
के
wala,
बाद
then I
मुझे
will say khichdi.
है ना द कंफर्ट फूड
Khichdi.
यस
Yeah, yeah, khichdi.
okay ma'am one place in India that you love visiting or some place that you have already visited and you've loved.
Hmm. I recently I had been to Himachal, but to be or I like visiting different places as such. One
Hmm.
single place where I will go like to go again and again. Nothing actually comes to my mind. I like to visit different
New
places.
places. And
Mhm.
anything that you have come back with a lot of memories, or this has been your very beautiful travel place.
I had been to Indianapolis. and
Okay.
it was a fall period, so that I liked very much, and I would like to go again there. So,
Lovely, lovely, ma'am. Ma'am, if you were not a doctor, what profession you would have chosen?
mm. Mm, maybe a teacher.
Yes, so perfect. Absolutely. Ma'am, one quality that you admire most in people.
Mm. Um, Means other people.
Yes.
Uh, those who are very frank, nothing to hide, and maybe speaking always the truth,
Honesty.
honesty.
Lovely. Ma'am, who inspires you the most?
My father.
Okay. Lovely. Ma'am,
Mhm.
three words your patients would use to describe you.
Three
मैडम आपको
different
आपके
words.
हाँ
Hmm.
आपको पेशेंट आपको आपको बोलते होंगे ना मैडम आपके बारे में बहुत सुना है
हाँ, वो तो बोलते
है
हैं
ना
जैसे आप आपको देख के ही पूरा हमारा पूरा बीमारी ठीक हो जाता है, वो तो सबको ही बोलते हैं
राइट
आई थिंक एवरी। हाँ,
नहीं नहीं
अपना
मैम आप
अपने जो
स्पेशल हो
पेशेंट है वो नहीं, ऐसे तो बोलते ही है, पेशेंट आते हैं कि मैडम बस आपको देखा। कभी कभी समटाइम्स इट हैपेंस ना कि बहुत टाइम नहीं है तो भी टेल कि असिस्टेंट से मिल लो, फिर रिसेप्शनिस्ट बोलते हैं कि आज मैडम नहीं मिलेंगे, फिर असिस्टेंट के पास जाने के बाद बोलते हैं कि मैडम एक देखना है सिर्फ मैडम को, तो दे
हाँ
विल जस्ट लाइक टू से हेलो।
हाँ
ट्रीटमेंट भले ही चलेगा कि उसने लिख के दिया असिस्टेंट ने, बट वो एक बार देख लो आपको ऐसे, समटाइम्स इट
राइट
हैपेंस।
यस यस मैम वन मैसेज दैट यू वुड लाइक एवरीवन इन दिस रूम टू रिमेम्बर
Yeah, whatever now you take help of technology, you do chat GPT, AI, everything, but please don't lose that connect and touch and that listening ability with the patient. That you
what
should always keep it to yourself.
you know that was so sincere so authentic absolutely just as what vibe stands for it was so amazing over to you Dr. Lotika for the closing
Uh, one second,
yes ma'am
every one of you introduce yourself and your family. So let me also
oh please ma'am
talk about
yes
that. Yeah. So I'm blessed that my husband, being a non-medico, also he supported me everywhere. So means because he is a non-medico, and but he gave me liberty whatever I wanted to do for my clinic and everything. So that is all. That's a big support. My daughter is a psychiatrist. She's married and she's at Gurgaon. And my son is a scientist. He is working for now Celogenics in the research team. So he's also now means actually he never wanted to become a doctor, but now fortunately or unfortunately at this moment he's now connected with me because he's into the pharma this thing. So
research
that's
wonderful ma'am it was so nice to know you more about you more about Dr. Kirti Samudra actually matlab it's not so all of us for that matter we fly because the wings are given to us by our family
yes.
that's a very important role that they play knowingly unknowingly so yes absolutely ma'am thank you so much over to you Dr. Lotika I think Lotika's network
Thank you so much. It's really been so interesting. Yeah. Is it better?
yes
Yeah.
Yeah.
Yeah, it's better.
So it's been really nice hearing about your stories, Dr. Kirti.
Hmm.
I think ma'am is facing some
Yes.
internet issue.
Yeah.
Mm.
So, Latika, we can see
I
you now. In fact, yeah.
I
Network
think the
issue.
internet is a little. It was really
Hmm.
very nice hearing. Can you hear me?
Yes.
Mm.
Huh. So it was really very nice hearing Dr. Kirti Samudra speak about her experiences and all that. What was very changing for me was that, how to with them. I think that's one of the most important things that we do as doctors when we are treating people, that we need to reassure them. And another thing, what I liked was that there is no such thing that don't eat anything. You can eat everything, but you eat something. That's really very nice. Dr. Ritu, what was your take home?
I think I truly, loved everything that Dr. Kirti mentioned. But majorly, one is it's not what she said, but I think, the fact that she is talking about education of patients and individualizing communication. I think that is the biggest skill that us doctors need to understand, because not everything you can learn. You can learn about science, you can learn about diagnosis, treatments, everything else. But when it comes to communicating, that communication itself, if you can target, वो बोलते हैं ना दवाई सही जगह पे लगनी चाहिए, but I think अगर आपका communication सही जगह पे लग गया ना, so then the patient is absolutely treated. And I think, ma'am, you said it right. The biggest certificate you can get is, when the patient says, "आपको देख के ही मुझे ठीक हो गया," because that is what the patient sometimes come to you for. It's not about just validating their treatment. They've come because it makes a lot of difference. They get empowered, they feel better. So I think that individualizing communication is what is a very big power as doctors, and especially women. We have empathy, so if we put that empathy and navigate the grief that the patient has and understand, then I think that is the best, I would say.
So thank you, Kavita, thank you, Latika, Pranjali, Rukia, and Ritu for inviting me over here. I was really means I liked it very much, and I will grow younger with all of you. So I'm so
So
happy
ma'am,
about
I
it,
would
and
like
that
to add.
empathy is the word what it should summarize everything. Like
Yes,
No,
I would
ma'am,
like
but
to
you
add
can
here.
speak one line that everyone has learned from you. So I am done now. Maybe Pranjali, you can go next.
Yes. So ma'am, what I would like to say is, uh, the most what I've learned from you is calmness. What I wanted to say in my segment also, because we can't teach our patients about stress management, and you are hyper or you are forcing the patient to manage your stresses. Your body language and the way you're talking, I can actually sense that your calmness and the way you are non-judgmental, you are treating your all the patients, individualizing the care. That is the important thing, and which I've learned from you today, ma'am. Thank you so much, and over to you, Dr. Kavita, for your take home.
Thanks, Dr. Pranjali. So firstly, thank you so much, ma'am, like for accepting and for being a part of us today. And we had so much fun. And I have always learned from you that a healer has to first heal thyself, and then only you can pass on the healing to anyone. So what Dr. Pranjali was saying, also I reiterate, calm. The calm is from within. The healing is from within. The happiness comes from within. If you're not happy as a physician, you're not able to be going to impart or share it with anyone. So thank you so much. And over to Dr. Rukia for her learning.
Ma'am, with all the segments that we've heard from you, I think what really touched me was when you spoke that, it's important that the patient is happy. आप खाली इतना कर लो कि पेशेंट खुश रहे. आई थिंक दैट इज द ब्यूटी ऑफ कि ठीक है तुम्हें खाना है खाओ लेकिन थोड़ा खाओ बहुत सारा मत खाओ. सो बट कीपिंग द जॉय अलाइव while you're treating is also what makes the patient feels heard. And second, you spoke about, learn to listen. I think we are all so, charged up in telling them all the knowledge that we have. आपको ऐसे करना चाहिए, ऐसे करना चाहिए, हम ये कॉन्फ्रेंस अटेंड करके आए, हम ये सुनकर आए हैं, अभी से आपको ये करना चाहिए. I think we are just too, we are overburdening our patients with a lot of information. So first, just listen to them. I think that is also very important. So, and being honest to what you do, that's about it. So I think, yeah, those are my takeaways from today. It's just so wonderful. Thank you, ma'am. Thank you so much.
Thank you, ma'am. It was really very nice. Am I audible?
Yes.
Yes.
Yeah. So we end with our signature vibe. If you can put your hands together.
Be the white.
Yes.
Yeah, the
Be the
W.
vibe.
W.
W. You can put your hands together and do. Yeah. So at the count of three, 1, 2, we say be the vibe. 1, 2, 3. Be the
Be the
vibe.
vibe.
Super.
Thank you, ma'am.
Thank you so much, ma'am.
Thank you so much, ma'am.
Yeah.
Nice talking to you.
Thank you.
Bye.
Thank you.
Thank you.
Thank
Bye
you.
bye.
Bye-bye.
Okay. Bye-bye.
Bye.